how to become a GP in the UK. So this applies really to UK residents, or if you're UK born, this applies to you. This does not apply to you if you're an international student, because there are different rules from if you're a UK resident or a UK citizen. So as you go through medical school. So there are different grades of medical school, because initially you do your GCSEs, then you do your A levels, which is usually 2 years. Then you pick your core subjects, which could be any of biochemistry, physics, biology, maths. Then you can choose to do art. So maybe 2 out of your 3 preferably should be sciences. So you can say, okay, I want to do maths and biology. Or if you're really serious about medicine, I would say pick chemistry and biology as your 2 core sciences. Drop the physics, maybe do English or arts or something else, just to give you more balance, or maybe even maths, because maths becomes important later in medical school as well. And so that's your A levels. Do I need to get A stars or A's? Okay, maybe, but maybe not. So let's say you got your A stars, your A's, you get through to the undergraduate scheme of medical school, which is usually a 5-year. It's a 5-year course, or it can be 6 when you do that extra, what we call it, intercalated degree, where you can do 1 year of maybe medical biosciences in between your 5 or 6 year course of medical school. Is like a sandwich, yeah, and that includes the placement year as well. So that's the undergraduate. Or if you maybe got poor grades like myself, you can go the longer route and do the what they call it, like maybe do a science degree, like again medical biosciences or anatomy or physiology or biochemistry. So you can do that for 3 years, or you can do that for 4 years and do again a sandwich year where you just go out and work and decide, is this medicine something that I want to do? And once you've made that decision, you now think, okay, now I want to apply for the graduate entry programs as well as the undergraduate programs. So the graduate entry programs are usually either 3.5 years or 4 years. I think Queen Mary's in London used to do 3.5 years. I don't know if that's changed, but you can get other 4-year graduate entry programs, like the Warwick University does the 4-year graduate entry program, and other universities now start to do the graduate entry program. Or you can apply for the undergraduate. Some universities will take you straight into the 2nd year of the undergraduate scheme. If you've already done, if you've done anatomy or physiology as well, you're basically repeating what you've already done. So some universities would actually take you into the 2nd year. Also, it might be important if you're considering bursary as well, because some universities don't offer bursaries. So if you're someone that's financially not well to do, then you might have to consider which university will offer me bursaries early on, because you might need a bursary in the 2nd year. Most universities do not offer bursaries in the 1st year, just because first year is kind of the weeding process, where basically the students who do not make it get weeded out prior to going into the 2nd year. So you finished your medical school, you got your distinction or your merit or your pass or whatever degree you've got. Then you now have to apply for hospitals, because the hospital is where you're going to do your foundation training. So it's called F1 and F2. So you become a foundation doctor. So your F1 and F2 is like your year 1 and year 2. You have what we call your specialist rotations. So again, some hospitals might do rotations every 6 months, which means you're doing 2 rotations in 6 months. And then that means as an F1 and F2, you've done 4 rotations in a 24-month period. Most training hospitals will do a block of 4 months. So you're doing 4, 4, 4 in your first year, 4, 4, 4 in your 2nd year. So your first year, you might do respiratory medicine for the first 4 months. Then after that, you might switch on to do endocrinology for another 4 months. Then you might go and do general surgery for another 4 months. Then in your F2 year, you might go and do accident and emergency. Then you might go and do, what else is there? Gastroenterology. And then you might do another specialty. What else is there? So, and maybe another branch of, surgery again. So that's your F1 and F2. So while you're doing your F1 and F2, then you have to now considering, what do I want to specialize in? Do I want to be a surgeon? Again, doing those rotations will help you decide, what you want to do. Do I want to be a surgeon, What kind of surgeon do I want to be? Do I want to be a general surgeon? Do I want to be a plastic surgeon? Do I want to be a colorectal surgeon? Do I want to be an orthopedic surgeon? So, if you're thinking of doing all this, you're using your rotations to really, make the most of it. Be in the theaters all the time, get your logbook signed, because you're going to have a logbook of skill sets. So, show that you've assisted, in theaters and all that stuff, because all that helps. Or do I want to be, a hospital medical consultant? So you're thinking, do I want to be an endocrinologist? Do I want to be a gastroenterologist? Hospital consultant? Or do you want to come out of the hospital into the community and become a general practitioner? So that's the main bit I'm going to focus on, being a general practitioner. So you've done your ST1, you've done your... So you decided I want to be a general practitioner. So you now apply, to become a GP, which means you have to do some exams, to get into what we call the specialist training. You've got your ST1 and your ST2. So you do the exams, now you're going to the ST1, and then you have to do rotations in the ST1, similar to your foundation. You still have to do rotations. So it might be more 6 months than 4 months now. So most STs tend to do more 6 months than 4 months compared to the foundation training. So you find yourself doing more focused specialties like obstetrics and gynecology, which is very important if you want to become a GP. You might do accident and emergency, which is very important. Why is accident and emergency very important? Because as a GP, you're going to be seeing a lot of acute stuff. So you need to know what to send to hospital and what not to send to hospital. So if you see someone with knee pain, you need to know, does this need to go to A&E? Is it something that I just need to manage, physio, do an x-ray, painkillers, and to come back and see? I did 2 blocks of accident and emergency. When I came to GP, my confidence was brimming, Also, psychiatry, mental health is very, very important, because you are going to be seeing a lot of mental health cases. I've seen a lot of GPs who did not do mental health training, and they don't know how to deal with mental health. So mental health training, psychiatry is very important to do. And pediatrics. So those are the 4 most important specialties you need to do in your SC training. Pediatrics, you need to know how to manage children. Psychiatry, you need to know how to manage mental health. Obs and gynae, you need to know how to manage women with complex women problems. Accident and emergency, you need to know how to manage acute emergency cases. You need to know when to call an ambulance, for instance. You need to recognize a blood clot when that needs to go to hospital. So during your foundation training, you are going to sit some exams, okay? You are going to have a portfolio, you're going to have a supervisor. Do your specialty training, not do your foundation. Doing your specialty training, you are going to sit some exams, I think there's I can't remember now, is it the AKT? Guys, you need to remind me, this is such a long time ago. I think you do the theory, which is the AKT, you pass that one, and then you've got what we call the CSA. So the CSA is called the Clinical Skills Assessment. So before you do all that, you've got a supervisor who's a GP partner in the surgery usually, and then your supervisor is helping you with with seeing patients, because during your ST2 you'll be doing your GP rotation as well, in addition to the obs and gynae and the psychiatry. So most people will do a bit of GP rotation in ST1, but ST2 they do a bit. Then ST3 is when you do a full 12 months of just doing GP. But doing the ST1 and S2 is when you start preparing for your exams. You can choose to do your AKT either in your ST2 year or in your ST3. Preferably you're doing your ST2 because you want to focus on the CSA. The CSA is actually the practical, the clinical skills assessment exam. So your supervisor will be helping you with patient scenarios. There'll be lots of video recordings, one-to-one. You'll be seeing patients. Your supervisor will be with you in the room as well. And you also have videos where you're recording, yourself and the patient as well. And the supervisor's watching the videos, and the supervisor tells you what you did good and what you did bad. And this is all in preparation for the clinical skills assessment exam. So now this is what happened. So before COVID, the clinical skills assessment exam was a role-playing game where basically, as an exam, you go into this room, there's an actor in front of you. The actor might pretend that they've got chest pain, for instance, and it's your job to get the history out of the actor, and it's your job to get the history out of the, not your job to get the history, and also based on the history, find out, what examination you need to do and what investigations you need to do. But remember, it's not all medical. What they want you to do is the whole holistic aspect, is it called psychosocial, socioeconomic? I can't remember now, but you need to find out how they manage at home. If it's a 70-something-year-old, are you going to send that patient back home by themselves? Who is helping the patient out? What can the patient do? You need to explore the whole psychosocial aspect. You also need to explore the mental aspect. This is why mental health is important. What's the mood of the patient? Could the chest pain be more mental? Could it be anxiety that's causing the chest pain? So these are all stuff that they'll be looking for you to do in terms of the exam. So I cannot remember how many stations, like is it 6 stations or 3 or 4? However, there will be stations of actors, and it's quite artificial because these are all actors, they're not real patients, and you're playing the game. The most important thing, empathy. So if a patient comes and says, "Oh, I lost my dad last week," don't say, "Oh, okay, so you've had a funeral, how are you feeling now?" Cues, follow the cues. "Oh, you lost your dad last week. Oh, I'm so sorry to hear about that. How are you managing? How are you coping?" So what they're looking for is empathy. I'm talking about how to be a GP. So these are all important things that you need to learn on how to be a GP in the UK, because a lot of I don't know what's the right word to use, but some people have missed the cues, or maybe they might sound aggressive, in front of the supervisor, and maybe that's just a cultural thing, and maybe they were not told that they need to kind of show us verbal and non-verbal cues. But empathy. I cannot hammer that long enough. Empathy. They'll mark you down if you don't show any empathy. They'll mark you down if you do not follow the non-verbal and the verbal cues of the patient. A patient might be doing all this in front of the camera. You need to find out why the patient is doing all that. Is that something that they're anxious about? Is the patient, autistic? Or follow the cues is my tip. So you've done the exam. If you failed it, you have about, I think they've extended the goals now. They're trying to extend the goals to 6. It costs more than £2,000 to do these exams. These exams are expensive. So the more exams you fail, the more money you have to pay. So it's not easy. You pass the exam, and you've gone from being a GP registrar. So I forgot to mention, when you get to ST3, you become classed as a GP registrar, which is the equivalent of a hospital registrar. So you only have 3 years of GP training, ST1, ST2, am I right? Or is it 2 years? Oh my goodness. I'm forgetting all this stuff so easily. So it might be, is it ST2? Do you have ST3 GP training? I think it might be 2 years, I think you only have 2 years of GP training, ST1 and ST2, and then you go straight into GP. So the training is quite short. It is quite short training, and you find that a lot of GPs do not have the experience because maybe they missed out on a specialty such as psychiatry, for example, and they don't know how to deal with mental health. So in a nutshell, that's how you become a GP. You pass your CSE exams and you become a newly qualified GP.